speaking about similarities, the lessons we can be learning now would obviously be from the COVID-19 outbreak. It appears vaccination will be another layer of check. What are the measures in place, at least from the outfit of the World Health Organization, working in partnership with African countries to contain the spread through vaccination?
Okay, thank you. So unfortunately, vaccines for MPox are in very short supply. They are not readily available. Some countries have these vaccines. So what is being promoted is that countries hold bilateral engagement with those countries that have the vaccines so that they can access some of these vaccines. But globally, the vaccines are in short supply. There's ongoing advocacy for more vaccines to be produced, but currently, as the situation as we have now, they are not enough. So we are promoting that bilateral engagement for countries to access vaccines from those who have.
I see. Personal responsibility will also count because aside regulation and all of the interventions, individual responsibility would have to come in. What's the message from the World Health Organization in that respect?
Okay, so as you rightly said, we have to take personal responsibility. So I'll start with hand hygiene. So unfortunately, that was a habit we picked up during COVID, but unfortunately, we dropped it along the way. So it's important that as frequently as possible, we wash our hands with soap and running water. The MPox is transmitted through contact. So obviously, if there's someone who has a rash, what you should do is go to a health facility and get tested, because MPox can look like several other diseases. And then for someone who is suspected to have MPox, it's recommended that you practice home-based care, isolation at home, so that you don't transmit it to others. So we should also avoid close contact with those who have a rash. In case there's someone at home who is in self-isolation, it's important that those frequently touched surfaces are regularly cleaned. In case you need to interact with that person, it's important that you wear a face mask. Avoid touching that person. Also, at healthcare facilities, it's also important that we set up a triage system so that when people come, in case they have a rash.
I see.